ஹலோ வணக்கம் என் உயிரினு மேலான இனிய தமிழ் மக்களே. Good evening, good afternoon, good morning, folks, from wherever you are watching. This is your host Venki with today's edition of Southern Spice USA. And இன்னைக்கு Southern Spice நிகழ்ச்சியில we have a very interesting guest that we are going to be talking to. And அவங்களோட டாபிக் என்னன்னு கேட்டிங்கனாக்கா, she's going to be addressing health inequities through donation of surplus medical supplies. So this is very, very interesting as a concept and as a thought. And who we have is a youth leader. Her name is Anushka Jain. She's from San Antonio, Texas, and she's a high school senior. And she's got this phenomenal initiative that we're going to be talking about. So, Nergale, put your hands together and let's welcome Anushka to the stage. Hi, Anushka. Welcome.
Hi, thank you. Thank you so much for having me.
All right, so it's so good to have you. We are very, very proud of what our youth are achieving these days. And you are a high school senior in San Antonio, Texas. So tell us and our viewers a little bit about yourself. Give an introduction of yourself, please.
So, yes, I'm Anushka Jain, and I'm a high school senior at Health Careers High School in San Antonio, Texas. Through my nonprofit work in Dream Donations, I've had the unique opportunity to facilitate the donation of surplus medical, including wound and skincare supplies, to different homeless shelters in my community. I'm also very passionate about women's health as I pursue a research in endometriosis, and I want to become a gynecologist in the future. Outside all of this, I like to take photos, I like to dance, and I love to learn about new cultures. Overall, my work in Dream Donations and all my experiences really make me eager to pursue a career in medicine in the future.
Oh, wow. So you are considering medicine as a profession that you want to pursue in the future. That's interesting. And you're a high school senior, so you must have started your preparation already. Yes.
Yes.
Okay. All right. So tell us about Dream Donations, please.
So, Dream Donations is a Texas 501c3 nonprofit which has the motivation and the goal to take surplus food before and now medical supplies from the San Antonio area and donate them to homeless shelters or nonprofit clinics in the area. So, we've had a two chapters of our initiative, one where we donated surplus food, and now sometimes continue to donate food, but we purchase it, and
Mhm.
we've shifted to donating medical supplies to patients in the community.
Okay. And how did it begin?
So Dream Donations began back in 2020. So one day, my family and I were coming home from this big event in downtown San Antonio. We had one box of leftover food that we took home, but we saw someone at a red light with a sign that said that I'm hungry, and we thought that this box of food that we had would go to much better use for this man instead of us who have the ability to get food whenever we want. So we
Hmm.
donated this box, and it felt very nice to help someone that way. However, on the way home, we realized that this event was so big, it definitely had much leftover food than this one box that we had. And there's so many people laying on the streets of San Antonio hungry. So that's where the initial concept was born. We decided that it was our goal to take surplus food from different places in our community and donate to homeless shelters. So we worked very closely with Subway, who donated their leftover breads to us, which we
Hmm.
gave to homeless shelters like Sam Ministries. However, when the pandemic began to hit harder, our donors, such as Subway, started to struggle well as well. So we started to shift from a surplus aspect to fundraising for these donor restaurants. And with this, we bought discounted food from them so that we could still support them and yet continue our initiative. Now, fast forward to this past year, I was having a conversation with Dr. Jay Shah, who is a wound care specialist in my city, and he was telling me how a lot of times wound care supplies from patients end up going to waste because of uh, like they are prescribed more than they need. So, for example, a wound that can be healed in 1 month may require 3 months of supply just in case. But then after 1 month, when it's healed, there's 2 months worth of very expensive quality medical supplies that are going to waste. So that's where the concept of the medical aspect began. So when he told me this information, I thought it aligned perfectly with our previous mission. So that's how I started to connect with different donors and recipients again for the new chapter.
Interesting. All right. For those of you who joined us late or who are wondering who's speaking, this is your host, Venki. And for those of you who are listening on the radio, I have a very interesting guest, Anushka Jain from San Antonio, Texas, talking to us. And you are listening to us on Radio Zindagi, 1310 AM, Parsippany, New Jersey, in 96.7 FM, Edison, New Jersey, and 540 AM in New York, New Jersey, Connecticut. Also, we stream live on Facebook and YouTube on Southern Spice USA. All right, so coming back to Anushka. So, you told us about how Dream Donations started. Now, it would have been difficult. I'm not, none of these initiatives are very easy. So, what was the most difficult aspect for you in kickstarting this initiative?
So for me, especially, I feel like the biggest hurdle that I faced was just the uncertainty if it would work or not. Because with Dr. Jay Shah's help, I did have access to supplies from bigger clinics and hospitals,
Mhm.
but the patient excesses that we were mainly trying to get access to, I wasn't sure if I would be able to gain access to those supplies because between me and patients, I can't go and contact every wound care patient in my city by myself. I had to mediate to give flyers and things to hospitals and to clinics. And through that, I had to trust that people would come and help. So that was definitely a big hurdle that I faced, which is just the uncertainty of that I would be successful and this would be able to be sustainable for me.
Okay, but uh, no issue with any kind of regulations that you shouldn't give medicines to people, stuff like that.
So that is also something that I'm still working with. So the type of supplies that I usually tend to donate are not prescribed or and they're pretty generic. So
Mhm.
and also in my flyers that I hand out, I have specifically said that we would only accept unopened or unused supplies. So these aren't like usually I don't have any medications that are prescribed that can harm people. So in my efforts, I also, make sure that whenever I'm donating supplies, I make sure to look and see if there's anything opened that I immediately discard it. And with that, that's also something that I do check.
That's cool. All right, so who are your typical beneficiaries, and how has your work kind of impacted the community or some of the beneficiaries themselves?
So the main beneficiaries for my nonprofit are the homeless shelters and nonprofit clinics that serve a variety of underserved people in the San Antonio area. Some examples are Corazon Ministries, SAM Ministries, Seton Home, Yanawana Herbolarios, and the Bear Area Harm Reduction Coalition. So it's a variety of different clinics, street medicine programs that accept my supplies
This
for
is
their.
all local to San Antonio area.
Right now, it's a local effort, yes, that
Okay.
I've contacted and donated supplies to, and usually they're the ones who are able to serve the patients like in the streets or their residents at the shelters themselves. So, and as for the impact, I feel like I have contributed to decreasing the medical resource gap in my city because of the volume of donations that I've acquired and donated as well. We've supplied thousands of dollars worth of wound care supplies and skincare supplies to all of these various populations of homeless shelters. And
Mm,
I believe that it's made an impact on their health as well.
okay. So what's the process? How do you collect these donations, and how do you ensure that the supplies are safe and in a good condition? And is there any kind of quality control?
So, with the process of collecting donations, I usually am contacting bigger clinics and hospitals for their surpluses, as well as I usually go interact with them in person to get to know their staff and then I hand them my flyers,
Hmm.
which have all my information as what kind of supplies we're willing to accept, and they have been very helpful, and I'm very thankful that they've been able to hand those out to different patients who've also dropped off supplies at those clinics or even at our office location. So mainly, I either go pick up supplies from these bigger clinics, or people are dropping them off to our office location. That's how the collection process works. And like I said earlier, we specified that we only take unused and unopened wound care supplies. So, and they're also, we only take generic supplies, no like prescribed medications, because we don't want to harm our patients and we want to make sure that we are helping them.
Hmm.
So we're very careful about what kind of supplies that we're accepting and donating. And before we give them, we make sure to explain what these supplies are, and to make sure that the people who are running these clinics know how to use them, and that it'll actually will go to good use.
Okay, perfect. So, do you have any statistics or any compilation of information on the impact that you've made and the patients that you've served and helped?
Yes. So over the course of Dream Donations, we've served over 2,000 meals to various underserved people in our city, as well as some work in India as well.
Hmm.
And for the medical supplies, we have donated about $4,000 worth of supplies to different homeless shelters in our area, and it is continuing to increase as well.
Brilliant. And you also said you mentioned something about doing something in India. What is that?
So it's just like before we well, in Dream Donation's initial stages, we also had taken a trip to India and done some volunteer work there, and donated food from various like bigger organizations in our city, Indore, and donated to
Okay.
different slums and things like that.
Uh-huh. Excellent. So you're not only serving your own local community, you're also reaching out across the globe and doing help to people back in your hometown. So that's very, very, very good, Anushka. This is brilliant. So what was the turning point in this journey for you?
So the turning point would definitely relate to what I said. It was my biggest struggle.
Hmm.
So when I first received my first patient donation, that was a huge turning point for me, because it made me realize that this actually can work and it can be sustainable. Because it made me realize that I'm not the only one that cares. Like I I do have the community of patients that I can rely on, and it really made me feel good that people were willing to make the drive or pick up the phone and just spread the word about it and contribute to my mission.
Okay. And of course, you're just a high school kid. Now you can't do all of this all by yourself. So what's the kind of support system you have?
So I definitely have a really good support system. My
Mhm.
parents, my mom and dad have been very, very helpful with all of this, whether it be collections, connecting with me with more people, helping design the flyer, and also the web design that we have.
Mhm.
Is all very thanks to them, as well as Dr. Jay Shah has been my mentor throughout this whole journey and connected me with various donors, and been really my guiding light throughout this. Lastly, I have two more board members, Mr. Craig Hopkins and Mr. Ricky Burks, who have been very helpful to plan the future steps and give me help with the legal aspects of all of this, and also connecting me with some more donors and recipients to further my mission.
Of course, the legal part is absolutely important, and I'm glad you have help in that area because you never know. All acts of kindness and goodness is all good, but it's at some point if there is any kind of legal issue, you need to be covered,
Mhm,
right? Yeah, very good. So, what's the vision for Dream Donations? What are you planning in the future? Do you plan to expand across other locations in the US?
mhm. So in the next year, my goal is to connect with at least 20 recipient and donor organizations, and also create a mobile app to make it more sustainable, to connect donors and recipients more directly, because currently I am still mediating every all the communication that occurs and the supplies that are donated. So I want to make sure that it can be sustainable on its own through the mobile app. so that I don't have to continue mediating it. Because if I am the one that has to mediate everything, there's no way that it could expand, right?
Yeah.
So and then so that's my initial goal for the next year. For the next 3 years, I hope to expand the initiative to different locations across different cities, because once it's just sustainable with the app, it should be pretty simple to implement across different areas. And further, my main goal in the future is to make it a global initiative to connect between cities, between states, and just to make sure that everyone in the world can get access to medical supplies that they need. Is obviously the goal in that.
Fantastic. So how do you think other people can get involved? For example, if I want to get involved in your initiative, or if you just, there are people who just want to donate. There are other people who may want to help you spread the word. So how do you get other people involved in this?
So for getting other people involved, the biggest thing would just be obviously to spread the word about it and
Mhm.
to help me really expand the mission and just show the work that I've done, as well as connect me with any more ideas of donors and recipients or any just suggestions on how I could improve my efforts. But there's also another aspect of the nonprofit that I've been trying to implement, or I'm starting to implement. So to make it easier to collect patient donations, I want to create Dropbox locations at community centers, public places, or religious institutions that people can conveniently drop off their supplies, and they don't have to go out of their way too far to help me with this initiative. So, if viewers have any suggestions of how I could get this process and to really solidify this concept, that would be very useful too. But in general, just having people spread the word is really a huge impact for what my efforts are.
Yeah, spread the word. Of course, that's going to happen through Southern Spice. Whatever, even if it's going to be viewed by 10 or 20 or 30 people, that itself, I think, is a good beginning. And I'm really glad we are talking today, Anushka. But I give you all my best wishes, and I hope that there are more people who jump in on the bandwagon along with you and take this good noble cause, and help you take it global. So before I let you go, I just want to ask you, as a high schooler, what's one piece of advice you would give to someone who wants to make a difference in their community?
So the
From a
biggest piece of
already
advice,
started.
oh, sorry,
Yeah,
that
go
I
ahead.
would give is that in whatever you're trying to work or help your community towards, you have to be passionate about it. Because without passion, there's really no way you can stay motivated to continue with your efforts, because obviously it's a very difficult journey with a lot of ups and downs. And my passion for really helping decrease that health inequity in my city and overall in the globe is what's kept me driven to continue this effort, despite a lot of issues that I may face, because obviously I am just a high school student at the end of the day, and it can be demotivating sometimes, but really the passion is what helped me stick through and
Mhm.
continue with this effort. So I would definitely say that is a key thing to keep you
Absolutely.
driven.
And of course, the motivation from the parents and
Of course.
friends, close friends, and probably your teachers. All of that would go a very long way. Anushka, thank you so much. You're doing God's work. It is very, very good and very brilliant. Good initiative. Keep it going. And I hope to have you back here on Southern Spice, maybe 6 months down the line, or maybe a year later, to celebrate how big you've grown with this initiative. So good luck. Godspeed. Thank you very much.
Thank you so much for having me.
My pleasure. All right, Nerle, that was Anushka Jain from San Antonio, Texas, talking to us on Southern Spice USA, with her wonderful initiative called, you know, um, Dream Donations. So it's basically addressing health inequities through donation of surplus medical supplies to people who need it. So on that note, Venki, taking off. See you again in another episode of Southern Spice. Take care.